everyone. I might just wait another minute. We've got the 14 online now, so I'll just might wait a few more seconds, 30 seconds, and then we'll start the webinar. We'll make a start. So good evening and welcome to tonight's webinar. This is our first webinar for us as in the digital health team that we've actually held this year. So it's quite exciting to be with you all tonight. So thank you so much for giving up your time and coming and joining us. Our webinar tonight is e-requesting update for general practitioners and practice managers. So my name is Sally and I'm from Eastern Melbourne Primary Health Network. EMFN is primarily funded by the Australian Government to improve the care and support people receive from health services. We aim to improve the health of our community, which includes using technology to make the broader health system work more efficiently. Tonight's webinar, we will be discussing 4 learning outcomes. So the first one is, what is e-requesting? Who is connected and uploading pathology DI reports to My Health Record? How do you set up e-requesting? And benefits of e-requesting. So before we begin, just to let you know that you are all on mute and you can at any time ask questions by putting them in the chat box, which is at the bottom. So if you can just put your questions in there and we'll get to them at the end of the webinar, of the presentation, sorry, not webinar. There will also be a survey that will come out to you when the webinar is finished as well. If you wouldn't mind just taking a few moments just to answer those few questions for me. Now we'll begin with the reading the acknowledgement. So we would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them and their cultures and to elders both past and present. So tonight we are going to be hearing from 2 amazing speakers. The first one is Samar from the Australian Digital Health Agency. And the second one is Melina from Melbourne Pathology. So I'm going to hand over to Samar. She's going to start the presentation for us tonight. And then Melina will follow. And after that, we'll have questions. So hand over to you, Samar.
Thank you so much, Sally. And thank you for everyone joining us this evening. I'm really excited to be presenting to everyone today. So today I'll be discussing My Health Record, as well as pathology electronic requesting, which Melina will also help present on as well. So just a little bit about the Australian Digital Health Agency. We get asked a lot, or I get asked a lot, what we do exactly. So we're focused on the implementation of digital health technologies to help improve health outcomes for Australians. And basically the National Digital Health Strategy is our roadmap for delivering on this. So the strategy itself is composed of 7 priority areas, and that's what you can see on the screen now. And My Health Record is one of the key components of this strategy. And the concept is about making health information available whenever and wherever it is needed. So this is really important because, as we know, across the different healthcare settings within the healthcare system, there's lots of different health systems there, and they all have vital information within them, but this information isn't necessarily shared, so it's not accessible by everyone. And we know that different people will have different healthcare providers involved in their care. So by allowing this information to be shared, it's just it's beneficial for both the provider in providing the best care he can, and also in making sure the patient is receiving the best standard of care as well. Okay, so what is the My Health Record? So it's an online summary of an individual's key health information. Now, we do stress it is a summary, so it's not a complete record. It's not designed to replace any existing records or to replace direct communication between healthcare providers. It's recommended to be used as an additional source of information to complement any existing records. So with the My Health Record, a key component of the system is that it is personally controlled. And this means that it's up to up to a person whether or not they have a My Health record, as well as what's in their My Health record and who can access their My Health record. So there's certain access codes a patient can apply to their My Health record. We have what's called a limited document access code, where they can limit certain documents, or we have a record access code where they can limit access to their whole record. So it's a bit like how we have in the social media sort of era now. You can sort of block someone from your profile or just block someone from like photos of your profile. So also key components of the system is that it's part of a national system and it's accessible at all times. So 24/7, no matter where a person is, they may be at home, away from home, their health information is going to follow them. And any time that they present to a healthcare provider, they don't have to worry about having to record their medical history. For some people, you know, it can be quite complex, and this can be associated with a lot of anxiety, having to record it and make sure that we record it correctly and haven't missed anything. So by having all this information within their My Health record, they can, you know, present it whenever they need to, and it's accessible when they need it most, which is at that point of care. So especially in an emergency situation, this would be a great benefit where time is quite crucial, and it will help support earlier diagnosis and ultimately a better patient outcome in terms of treatment. And because of the nature of information that's within a person's My Health record, it's only, you know, makes sense that it's going to be heavily protected. So there's legislation that's specific to My Health record, which is the My Health Record Act. And we also have a lot of other security mechanisms. So we at the agency, we have a cybersecurity center, and they monitor the system 24/7, so no days off for them. Other safeguards we have sort of firewalls in place, as well as secure login processes. And there's also an audit log. So all records of access are monitored, and any misuse of the system is associated with penalties. And also it's quite particular in that not any system can be connected to the My Health record system. Any software needs to go through a conformance process before it can connect to the system. So in terms of statistics we have so far, so they've been sort of significantly increasing, which is really great to see. So as of March, we've got more than 22.9 Australians that have a My Health record. And then within those My Health records, about 89% of them have data within them. Now, this data will vary, so depending again on the person, sort of how complex the medical conditions are, and how many people, sort of how many healthcare providers they see, the information will vary. But of the information that's within a My Health record, we've seen more than 2.7 billion documents uploaded to My Health record. And that's a combination of consumer documents that they upload themselves, as well as clinical documents that are uploaded by hospitals, pathologists, and medicine documents that are uploaded by GPs as well as doctors. And we also have documents that are automatically uploaded by Medicare. Here we can just see another breakdown of the documents. So in terms of pathology reports, there's more than 96 million pathology reports that are available now within My Health record. And in terms of, again, like sort of prescriber engagement, so we have over 97% of GPs are registered, and 88% of them are actively using the system. Similar with pharmacy, we have 99% registration and 93% usage. And we also have really good statistics with public hospitals that are uploading the discharge summaries. And then sort of what we're looking to do now is engage more with public, private hospitals, as well as some specialists as well. Because in the end, sort of, it's just like a domino effect. Once it's got to be a combined effort, the more everyone's sort of engaged, then the more useful the My Health record will be. So in terms of accessing My Health record, just before I get into that, I'll just touch on consent. So we always get asked about if a prescriber or provider needs to request consent from the patient. So they don't need to get specific consent. The provider is authorized to both view and upload information to a person's My Health record, as long as they're providing care to that patient. So they just can't do it for sort of a patient that they've never seen or never consult with. It needs to be someone that they're directly involved in their care. And also, they're under no obligation to access a person's My Health record, you know, for every single patient they see. It's case by case, you know, up to their clinical judgment, depending on the circumstances. In terms of accessing the My Health record, so a healthcare provider can view a person's My Health record through their clinical information system. So this would have, again, undergone like a conformance process. And then through the clinical information system, they can also upload information. And then there's also, in the case where the clinical information system isn't yet sort of connected, then they have the option to access a person's My Health record through the National Provider Portal. The main difference being that the National Provider Portal is a view-only platform where you can download, but you can't upload any information onto that platform. So generally, we suggest that sort of in the interim until you get your clinical information system up and running, because ideally, once the clinical information system is connected, it's just a lot easier to integrate into your workflow because you won't have to open a second browser. It's within the patient file that you already opened. So in terms of patients as well, they have full transparency to their My Health record, and they can access their My Health record through their MyGov accounts. And there's also apps where they can access their My Health records. There's Healthy and Health Now are two apps that can be used by the consumers. So here we can see sort of the range of information that you can see within a person's My Health record. So the three main sources being the provider documents. So here is where we'll see the pathology reports and the diagnostic imaging reports. You can see there in the list, the shared health summaries. So this is a really important document in that it's generally one of the first that's accessed by another healthcare provider. It's generally uploaded by the person's sort of primary caregiver, and then again, it has 4 key areas of information. So if they were to present anywhere else and someone else was to look, it will just give them a great sort of snapshot of their health status, and they can sort of take it from there. Consumer documents, again, really important, especially for example, for aged care now with advanced care planning information, they can have that information available on their My Health record, as well as emergency contact information. And Medicare documents are helpful for a lot of providers as well. They can look up sort of the Medicare claims, see what claim numbers have been claimed already, and when the patient is eligible for another one. In the middle, what you can see there, these aren't sort of documents that are uploaded. These are views that are automatically generated by the system. And these are also really important in that they extract information from the documents within a My Health record, and they display in a consolidated view for the healthcare provider. So this will save them a whole lot of time during their consultations from having to look up all the different bits of information, and just provides for a better, more efficient consultation time. So within these, the overview, so we'll be looking at the pathology reports overview more specifically for tonight. And then we have the immunization view, which is one of the recent enhancements, which we'll go into a little bit as well. So here is the pathology reports overview. So again, it's any pathology reports that are within a person's My Health record. It will extract their information and have it available in one view. And then it also groups them by dates or by their test type or even by the organization. And then there's hyperlinks, which the healthcare provider can then click to then view the original reports. So again, instead of them having to look for the individual reports first, they can access it, get a nice sort of overview of exactly how many reports are there as well, and then they can access their information. One key thing to point out, which I'm sure will come up again later as well, is that with pathology reports, once they are uploaded to a patient's My Health record, they are immediately available for the healthcare provider to view. However, for the patient, there's a 7-day delay before they can view their results. And this is to allow time for the healthcare provider to review the results and sort of plan their next steps and organize a follow-up appointment with the patient. And then after that, it's available for the patient, and the patient can come back to their results and sort of they can monitor their own progress over time. This is an example of hospital discharge summaries. So these are important in that they can also contain pathology results. So when a patient's come out of hospital, again, instead of the GP having to sort of wonder what exactly happened in there, they'll have a full the information available to them. And again, it avoids them having to reorder any tests unnecessarily if they've already been done. Okay, so just to touch on now the My Health record enhancements. So these are quite recent. So sort of end of April, early May, you might have noticed this in your clinical information system. So previously, immunization information was only available through the Medicare overview. And also it was only information that's from the Australian Immunization Register. Now, this isn't necessarily a comprehensive list in that the Australian Immunisation Register only recently expanded to be a whole of life register for adults. So adults specifically, anything before 2016 might not necessarily be available on the Australian Immunisation Register. Also keeping in mind previously, it wasn't mandatory for healthcare providers to report vaccinations to AIR. Now that's changed this year. So as of 1st of March this year, all influenza and COVID-19 vaccinations need to be reported to AIR. It's proposed that the rest of the vaccines that are part of the National Immunization Program might follow from the 1st of July. And again, if that's the case, it's just, this will just be a more comprehensive list. So currently you can still access this information through the Medicare overview. However, now there's also this immunization consolidated view. Now this is also one of the overviews. So usually within your document window, it'll be sort of at the top with the other overviews, or you might have to adjust some filters. So the default display for this new view is the let me get the pointer, is the Australian Immunisation Register. So this will, which will be what you'll see in the Medicare overview. But also other key areas we have in this view is the status of the individual according to the National Immunisation Program, as well as their COVID-19 immunisation status. So with their COVID-19 vaccination status, if it doesn't show up at all, this just means that they haven't received any vaccines. And then in the event that they've received one vaccine, it will show up as not up to date. And then when they've had both vaccines, it'll show up as it's up to date. So just those things to keep in mind. Then we also have a section there for, here we can see, for next immunizations due. So this again, this will pull on information that's in the Australian Immunisation Register, and it will be calculated based on the date there. And then we also have the notices section, and this will be for any additional information in AIR. So this could be information about immunization exemptions or a person participating in any vaccine trials. So that will be there. In the next sort of tab there, we have the immunization history. Now this will include the immunization information within AIR, but it's also going to capture immunization information that's in a person's shared health summary or an event summary. And the great thing about that is this helps capture any missing information. So again, because previously it wasn't mandatory to report to AIR, so anything that's not in AIR might have been in a shared health summary or an event summary. And the differences as well is a shared health summary will have immunizations from the person's main primary care clinic, whereas an event summary might include immunizations from if they see an after hours GP or a pop-up flu clinic elsewhere. So that would all be available in that view. Now this might mean, so as the benefit is that it captures missing information. One thing to keep in mind is you might have duplicate entries in there. But again, that will be, you can easily filter that out by applying the filters according to the source. And then you just match up all the information. If the date is the same, as well as the immunization and the vaccine dose number, then you'll be able to tell whether or not it's a duplicate entry. Okay, and just to briefly touch on the National Provider Portal enhancements as well. So in the National Provider Portal, the immunization information has actually been removed from the Medicare records. And now there's a dedicated tab, as you can see at the top, which is immunization records, where they'll be able to access the same thing. So the immunization information from AIR, as well as a shared health summary and an event summary. The enhancements to the National Provider Portal include an alert. So you can see an alert now from the home page. Now this alert is specific for the COVID-19 vaccination, and this will only show up in the event that they've had one vaccine, and it's going to have an alert there for their second vaccine. And then as well, and next immunizations due are available in the National Provider Portal, and there's sort of like a color coding system there. So red will indicate that this vaccine is now overdue, and then we have orange, so it's highlighted orange about 3 months before it's due, up until it's due, sort of as a prompt. And then anything that's coming up, but sort of still not within 3 months, will usually be gray, which you can see there. So this is just, this is also going to be available in the consumer portal for the patient to access. So they'll also see all this information. So again, full transparency, they're just as involved in everything as well. Okay, so now Pathology E Requesting. So this is also sometimes referred to as electronic requesting or e-ordering. So it's all the same if you hear any of those terms. So just a very brief workflow that I'm sure Melina will touch on as well. So when the e-request is generated, the information is automatically shared with the laboratory information system. And then once it's presented, the barcode on the paper request is scanned, and this will then automatically download all the information there. And then once the results are available, this will also, an alert will then be sent back to the healthcare provider to let them know it's ready. And then in some cases, which we'll look at in a bit, in some cases, the results will be available in the person's My Health record. So how can we tell if a pathology request is an e-request or not? So as you can see on the screen here, we have a standard pathology request there. So it's printed on a piece of paper. You can see the patient details, the tests that have been ordered, and then the doctor has signed it at the bottom. Now in this next screen, we have the exact same request. Now the only difference is that there is a barcode on this request. The barcode doesn't need to be here, it might be somewhere else, but it's going to be on this piece of paper. And that's how you know that now this is an electronic request based on this barcode. So when it's generated, it's going to be available at the pathology provider, but the patient will still be given the paper request as well. And then once this is scanned at the pathology provider, it's a lot easier for the staff. It streamlines the process, less transcription errors there in terms of, no data entry needed, less waiting around time for the patient. They don't need to sort of present all the different bits of information because it's all contained within that barcode. So here we can see some comparisons of the challenges of paper requesting and then versus the benefits of electronic requesting. So where we have the private pathology reports available, we see generally a lot more efficiency and a better consumer experience. So for example, I mentioned in hospitals, if they have access to previous pathology reports, they won't have to order extra reports, or in the case where they've ordered reports, then when the patient goes to see the GP, there's no doubling up of work. In terms of the transcription errors, as I mentioned, less data entry required, so less chance for error. And we all know that the idea of changing from old habits can be a challenge, but with the e-requesting, there's actually no change to the doctor's workflow process at all. It's still the same process. If anything, there's actually other features that I'm sure Melina will get into in terms of a customized pathology test, etc. And then also, as consumers become more aware that they can access their pathology results, through their My Health record, then there'll be less requests for copies of their pathology results to be printed out, which, again, it's just less admin work. So how do we know who is currently connected or not? So on our website, you'll find a list of pathology providers as well as diagnostic imaging labs who are uploading to My Health record. Now on this website, there also there's some that are highlighted in bold, and these will refer to the pathology providers where there's no specific requirements in place and it's pretty much an automatic process. Then there's other pathology providers where there's an extra step. It's not sort of a big step, but just one extra step that needs to be done, which we'll have a look at soon. Something to point out here is that a pathology service won't upload a report to a My Health record where there's any existing state or territory legislation that prohibits the disclosure of sensitive information without the person's consent. So this, for example, in reference to like AIDS or HIV status tests. So whether or not there's specific requirements in place or not, the sort of legislation will prohibit that being uploaded without explicit consent. Okay, so having a look here at the pathology providers that don't have any specific requirements. So in Melbourne specifically, we have the Dorridge Pathology. So if a patient can take their request to any one of these pathology providers, and then within 7 days, that will be available within their My Health record, assuming they have their My Health record, and the information will be stay on their My Health record for as long as it's active. The only exception being for any COVID-19 pathology reports, these are available within 24 hours. So there's no sort of 7-day waiting period for that. So here, these are the pathology providers that have what we call sort of specific requirements to upload. So Australian Clinical Labs, Sonic Healthcare Labs, and you'll find these in all the states and territories. So the requirements here is that the request needs to be an e-request, so it needs to have that barcode on it. And also it needs to be generated, and to have that barcode on it, it's going to be generated from a compatible version of the software. And also the requesting practice will need to be activated for e-requesting with the pathology provider. So they'll need to contact the pathology provider directly to ask to be activated. And then that means when they send the patient to that pathology provider, then that person's results will be available for the GP to immediately view. If the practice sort of is in the habit of sending to more than one pathology providers, then they will need to contact each of those providers separately. And just keeping in mind that some clinics may have been set up for e-requesting in the past, but if they haven't made that call to notify the pathology provider, then those results won't be uploaded. So that is an important step to do. In the event that a practice isn't able to refer to a pathology provider that has the capability to upload, then the patient can still take their request to any other provider that doesn't have the requirements. And so really it just gives the patient lots of choice. They're not sort of locked in to go to one pathology provider, especially if they want to have their results available in their My Health record. So which practices can participate? So as I said, there's software requirements in place. So any practices that are using these versions of the clinical information systems are able to participate in e-requesting. We do get asked a lot about, I think, the Genie software. Yeah, so that's not sort of now, it's hopefully in the pipeline, just not at the moment. But again, any practices that are using software that isn't listed here, they can still refer the patient to a pathology provider that doesn't have requirements in place to then have those results available. And also some clinics aren't aware of certain pathology brands that are local to them. So we do, we put a list together here, and then the practice can just ring the lab and ask to be activated to enable e-requesting. So that's all from me. I'll pass on to Melina. Any other information that's related to My Health Record is available on the My Health Record website. We have lots of e-learning modules available on there as well that are really helpful. And any information related to any other digital health tools can be found on the Australian Digital Health Agency's website. So I'll pass on over to you now, Melina.
Hi everyone, thanks for joining us this evening. I just wanted to give you a brief overview on how e-orders from your practice management software come into a lab. And this is just a general overview that Dorovich and ACL would also be using. We all use the same main medical software in your practices. And I guess I work from Melbourne Pathology, so this is just how the process works for any doctors who would be sending e-orders to Melbourne Path. So there's three main things that we need to know before we could just send results to My Health Record. And the main three things are a practice needs to establish how they're going to get their IHI service up and running. The main thing for pathology is that we need to get e-orders, or we've elected to receive e-orders from a pathology a clinic in order to upload the data for a patient succinctly and perfectly from your practice management software into My Health Record. We don't want to have to be manually transcribing information for a patient, and Digital Health would prefer us to send an IHI number to match a My Health Record. And as a pathology provider, we've decided the easiest way to do that is via an e-order. And once we've established e-ordering within your practice management software, you need to let us know that you'd like to upload pathology reports for all of the patients attending your clinic to My Health Record. And we can enable that in our system. So as long as the patient has opted in to upload their results to My Health Record, each and every time they present to a pathology provider, their results will upload to My Health Record. On one of Samar's slides, it does show that Sonic is not currently uploading results via ZMed. That is true. We are only uploading via Best Practice and Medical Director at the moment. We are working with ZMed at this moment in time, and we're hoping to be able to establish e-ordering with their software in 2022. So during a consultation with a patient, a doctor will write a referral, will print a referral. It could be via telehealth or it could be in person, and a pathology request is generated. When you're using e-ordering in your software, the print button will send to the pathology lab the information in the barcode. So it'll be ready in our laboratory information system, or our LIS, for the patient to present to a collection centre. The patient's IHI is encoded in the e-order barcode, but we can't see it. It's not printed on the form, and it actually isn't displayed in our system. This protects the patient's privacy, but it also ensures that when our results are available to be reported, they will go directly to that patient's file. When you're using e-ordering, as Samar indicated earlier, a barcode will print on the referral. At the moment, of course, during COVID, a lot of telehealth consultations have been occurring where the patient can't get the form physically or take it to a collection centre in person. If we have a mobile phone, we do actually have options for sending an SMS to the patient's phone and a barcode to their phone, which can be scanned upon request at the collection centre. At this moment in time, with so many pathology companies out there, we haven't really established paperless referrals, but we are quite interested to see how e-prescribe is going, and we're watching this space quite readily. Moving to a paperless solution with no referrals in the future and just sending an electronic message to your primary pathology provider is perhaps the way that pathology requesting will go, but we're not quite there yet. So at the moment, barcodes still need to be presented and printed on referrals for us to get that IHI number from the patient and to upload to My Health Record. At the point of collection centre, our staff will either scan the barcode from the patient's mobile device if they've been sent a barcode or a request by the doctor to their phone. Otherwise, we'll scan the referral. Once we've scanned the barcode on the referral, it'll actually release that data from the e-order episode into our laboratory information system. Up until that point, it's held in a cloud, and it's held there for approximately 12 months. So if the patient never presents for their pathology at a Melbourne Pathology Collection Centre, for example, and instead goes to Dorevitch, we will never get that e-order come through into our system. And just like most referrals, after a 12-month period, they do expire. So if the patient never presents for the referral, we will never have that information come into our system. So we really still need to match the e-order with the patient presenting to finalise that loop, if you will, in the whole e-referral, e-order barcode to My Health Record system. Once we've received the samples that have been collected from the patient, the samples are receipted into the lab and all the testing is done. Once the reports have fully been authorised by the lab, and that could be across many different departments, and of course it depends on how long some tests may take, the episode for that patient is uploaded, one, to the doctor's software, we will download it to them, and then we'll also upload to the patient's My Health Record. The patient, in most cases, is able to access the results within 7 days of the pathology reports being available. And Samar is correct. During the COVID period, we have been uploading all COVID results to all patients who have opted into the My Health Record, so that during this very precarious time, patients and healthcare providers have been able to see COVID results, especially if patients have been admitted for surgery or to a hospital and they needed that clearance. We do have some tests, including some genetics tests, which we do have longer delays on them. For example, first trimester screening. As we don't do that test in-house, it's actually sent to another provider in Victoria, VCGS Pathology. So we have the extra delay to wait for that report to actually come back to that lab before we can report it to the doctor and then upload to My Health Record.
Thank you so much, both of you. That was excellent. Now we do have a few questions. The first one to Samar, e-request path form. Do handwritten requests added to the e-request get performed too?
So when they say added to the e-request, I think if you mean like, so if it has a barcode, yeah, if it has a barcode, that's an e-request, and that's one of the requirements for the pathology providers that have the requirements. But otherwise, I think that means the ones that don't have any requirements in place, it's okay.
From a pathology point of view, we have a specimen reception area, and I think you'll find most laboratories do. And we have that for two reasons. One, to check the referrals and the samples that are coming in. And in some cases, we will always have software that will not be able to support e-ordering, and that's at the software's discretion. We often find in a lab that doctors at the end of a consultation will handwrite a test, and they've already printed out the referral, and it might be patient at the end has said, oh no, I've had some trouble going to the bathroom, might want to do a urine culture. The specimen reception department that we have actually checks referrals for handwritten tests. Even though that test may not be included in the original barcode, what's most important is we have the patient's information to upload to My Health Record. And of course, we always check referrals for extra handwritten tests. And I don't think that's a process that will end anytime soon. So yes, handwritten tests will be performed by the lab, and those results will be uploaded to My Health Record.
Excellent. Seeing I got that one wrong, as in who to give that question to.
No.
It came in the first part of the event, so I just handed it to Samar, so I apologise.
No, all good. Thanks, Melina.
So when will the pathology providers stop needing the patient copy? I'm thinking that's probably Melina as well.
Yeah. Is this the little slip at the end of the pathology request? I think it's the tear away the perforated slip. They don't actually need to have that now if they don't want to. A lot of patients want to have it so they've got a check of the results, and maybe the next time they see the doctor, they want to read out the test that they know that they had ordered. We actually can give patients copies of their own results if they wish to. This has always been an option at any of our collection points, and I know Dorovich and ACL offer the same thing. All we require is a patient to fill in a consent form if they would like a copy of their own results. And once that form is delivered to our results department and they can verify who the patient is, we can send the patient a copy of their own results.
Brilliant. This is definitely a Samar question. In case of telehealth, can the patient go directly to the pathology provider and get his blood test without a pathology form?
As I think Melina touched on this one as well. So in the case where they receive the barcode on their phone, then they can, but yeah, no, they won't be able to go to the pathology provider without anything. I wonder if that's in the far future, but yeah, not currently.
Most definitely it is, yes.
Next question, can results ordered by another doctor and copied to me be seen on My Health Record immediately, or do I need to wait 7 days like the patient to view CC'd results?
So the patient, when they access their My Health Record, they do it through the consumer portal. So similar but slightly different, but any healthcare provider will be able to access the My Health Record through, for example, the National Provider Portal or the Clinical Information System. The 7 days is specifically for the patient through the National Consumer Portal.
Good question.
This is the last question so far. So if you would like to ask any more questions, please just put them in the chat now. So if practices want the barcode to be SMS to the patient having telehealth appointments, how do they set this up?
On one of the screens that Samar showed earlier was your local contact for your lab of your choice. I think there were some email addresses that you had up, Samar, and some phone numbers. I think that's the best way basically to contact there you go, contact the laboratory that you use. If it is Melbourne Pathology, we have our phone number and our email address there, but there are other labs as well as Australian Clinical Labs, and we can arrange that for you.
I actually don't have any more questions. So that's it, unless somebody would like to, any of our attendees would like to put any more questions in. But if not, we can have an early mark. So I would like to thank both our guest speakers tonight, to Melina and Samar. That was a really great and insightful presentation. I will be sending out to the people that have attended a copy of the slides and also a copy of the recording, so you can view that at any time. And also potentially, you know, if you've got other staff that you would like to view it as well, they certainly can, because I'm sure they'll get a lot out of it. So, so thank you all again for attending the webinar tonight. And yeah, enjoy your evening. You've got an early mark now, so thank you very much for attending. Good night, everybody.
Thank you.
Thank you.